We're your hosts, Rafiq,
And it's Gerald.
and welcome to Psych Pals. Now, we've been doing this show for, how long has it been? 4 months? Yeah, since September. And obviously, we've enjoyed exploring the biological level of analysis, where we talked about localization and parts of the brain, and recently we explored the cognitive level of analysis, where we talked about schema theory and perception and focus and so much. It's really been fascinating and useful for hopefully you as much as it was for us. And today we want to talk about and focus on something a little different than usual. For the next week, we're going to be talking about abnormal psychology. And over the next few episodes, we're going to explore a bunch of different mental disorders and clear up all the false schemas and about mental illnesses and disorders and focus on targeting the facts. Psychology, as we covered in episode 1, is the scientific study of the human mind and its functions, especially those affecting behavior in a given context, or the science of the mind and behavior, or the science of the mind of the mental state and processes, or the study of thoughts, feelings, and behaviors. Whatever you like to call it, abnormal psychology is pretty much the same thing except abnormal. In other words, it's like sitting in a classroom on a normal school day and everything's fine. That would be your psychology. But then, if, for example, one of your peers wasn't wearing any clothes, that's what we like to call abnormal psychology. Anything out of the ordinary, often exceptions are referred to as abnormal.
Now, it is normal for someone to feel anxious. I'm sure everyone does from now and then. For example, when faced with a problem at work, before taking a test, or making an important decision, the person is likely to feel nervous. However, anxiety disorders are different. They can cause such distress that it interferes with your ability to lead a normal life. This type of disorder is a serious mental illness. For people who have one, the feelings of worry and fear are constant and can be disabling. But with treatment, many people can manage these feelings and get back to a fulfilling life. There are 2 major types of anxiety disorders that include panic disorder and social anxiety disorder. People with a panic disorder condition have feelings of terror that strike suddenly and repeatedly with no warning. Social anxiety disorder is when certain social or performance situations are avoided due to substantial fear of being judged or embarrassed in front of other people.
So, in today's episode, we're going to be talking about generalized anxiety disorder, and it can be scientifically defined as a psychological or physiological state that can affect emotions, cognitive processes, and social behaviors through concern and fear, meaning how worried you are or scared you are about something. Psychologists found this trait of anxiety all the way back to our cavemen, and it's an inherent and instinctual feeling that we respond to when we sense danger. Now, everyone experiences anxiety, and often it's through stress, and we call this normal anxiety. Normal anxiety often aids us and helps us improve our work ethic or change behavior in a positive fashion. For example, anxiety over finishing your psychology project make you start doing your psychology project. But when simple anxiousness turns excessive and it merges with stuff like paranoia and distress and depression, it turns into what we like to call abnormal anxiety. The excessive concern or worry about how you look at a party or not being able to cope with all the workload is what leads to not a better work rate or more concentration, but instead a breakdown that only further discourages the person in those activities. For example, into crying in a corner and never leaving your house. Making the distinction between normal anxiety and abnormal psychology is key in avoiding stigmas that continue to float around and addressing a very serious issue.
The criteria for the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, include showing excessive anxiety for certain topics, events, or activities. This feeling must occur for at least 6 months and must be excessive to fit the criteria. The anxiety and worrying must be associated with at least 3 of the following physical or cognitive symptoms. In children, only one symptom is necessary for a diagnosis of generalized anxiety disorder. Edginess or restlessness, tiring easily, more fatigued than usual, impaired concentration or feeling as though the mind goes blank, irritability, increased muscle aches or soreness, and difficulty speaking. Compared to the Chinese and European ICD-10 diagnostic manuals for generalized anxiety disorder, which states only that the patient must have primary symptoms of anxiety, most days for at least several weeks at a time, and usually for several months, the patient usually recognizes that his or her worry is out of proportion in its duration or intensity to the actual likelihood or impact of the feared situation or event. You have experienced social anxiety disorder if you have felt excessive high levels of fear, nervousness, blushing, excessive sweating, trembling, or muscle twitches. The frequency and severity of panic attacks varies considerably. Some people report moderately frequent attacks that occur regularly, such as once per week, every month, for many months. Others report a cluster of frequent attacks, perhaps one per day, that occur for several weeks, followed by a dormant period of several months without any attacks. Genetics is the most prevalent explanation of obtaining an anxiety disorder. At birth, there are observable temperamental differences. Some babies are more sensitive to stress stimuli than other babies. These differences remain as the child matures. People born with these extra sensitive temperaments are thought to be at greater risk of developing anxiety disorders. One similarity in the biological composition of humans is the human response to fear. This response is known as the fight or flight response. This adaptive response, in association with the hormone adrenaline, serves to decide whether to confront or flee a certain dangerous situation. There are other hormones that cause anxiety, like high levels of the thyroid hormone or low levels of dopamine. The human body is thought to consist of 10 complex systems, and more than half of these 10 systems are involved in the production of anxious and fearful symptoms. The nervous, cardiovascular, respiratory, digestive, excretory, and endocrine system. These 6 systems are responsible for physiological, electrical, and chemical changes that cause and affect anxiety symptoms.
Cognition and the cognitive level of analysis is also directly related to anxiety. Cognitive processes guide behavior and can create anxiety, but at the same time, they can change as a result of anxiety. The main cognitive processes we'll be looking at are attention and perception. How much attention you pay to an event results in different interpretations of the event. For example, judgment can lead to social anxiety. Likewise, anxiety can negatively increase attention by making the slightest giggles turn more prominent and more hurtful. At the same time, perception and the way you perceive certain things in your environment can cause anxiety. For example, perceiving judgment and criticisms in different ways can make them have different meanings. They can turn from helpful criticism to simple rudeness. In a similar fashion, if you have anxiety, the perception of different social gatherings can turn into more like an impossible mission. Aside from cognitive processes guiding behavior and therefore anxiety, another principle related to the cognitive level of analysis is how technology is related to anxiety. Technology has shown that in parts of the brain, such as the gyrus and the amygdala, are far more active in patients that have anxiety. Finally, knowing that social and cultural factors affect cognitive processes, we know that the media, for example, embellishes stuff like physical beauty and perfection. This allows people to become far more self-conscious of themselves and therefore possibly develop social anxiety as how they are perceived.
Alright, right now I'd like to discuss a research study, Cultural Aspects in Social Anxiety and Social Anxiety Disorder, conducted by Stephen G. Hoffman and Anu Ansani. This aims to examine cultural aspects in social anxiety and social anxiety disorder. They investigated the literature on the prevalence rates, expressions, and treatments of social anxiety as they relate to culture, race, and ethnicity. They also investigated factors that contribute to the differences in social anxiety between different cultures, including individualism, collectivism, perception of social norms, self-control, gender roles, and gender role identification. Their hypothesis suggests that the prevalence and expression of social anxiety depends on the particular culture. Their research included several conducted surveys pertaining to the prevalence rates of social anxiety disorders among certain ethnic groups. They hoped that these surveys would shed light in whether being a certain ethnicity correlates to the likelihood of obtaining an anxiety disorder. They concluded that social fears are very much dependent on a particular culture. The same social behavior may be perceived as normal in one culture opposed to unreasonable and excessive in another. Cultural syndromes may lead to the expectation of certain types of embarrassment in particular situations, and the meaning of social anxiety disorder symptoms will be influenced by multiple factors like gender role identification, general ideas of shame and what is shaming, and how cultural syndromes influence DSM disorders.
Like most mental illnesses, anxiety is an individual-based mental disorder. The problem is that everyone's case is different, and what complicates the process even further is that the cause of anxiety is often difficult to identify. For example, not understanding what makes you scared of doing a presentation in class makes it really difficult for you to stop being scared of doing presentations in class. Early treatment of mental disorders, such as anxiety, were counteracted with permitting them into mental asylums. The treatment that they met inside was often physical-based. For example, they were often sprayed with water to distract them away from their anxiousness. Likewise, they also took very hot baths to sedate themselves so that they didn't feel anxious afterwards. More cruel and slightly more aggressive techniques involved injecting insulin into them or electrocuting them while wet so that they would go into a coma and wake up not anxious. Modern treatment has obviously evolved a lot, and now our methods are far more ethical. For example, we focus on long-term and short-term solutions. Short-term solutions often involve drastic pills that give immediate and instant relief instead of targeting the root of the problem. We also have stuff like organic methods such as eating different types of foods and other social activities that help relieve the stress. But once again, these don't target the root of the problem. That's why we have long-term solutions. Long-term solutions target the base of the problem. For example, you either take medication or psychotherapy. Medication often involves pills that take a gradual change and target neurotransmitters such as epinephrine or dopamine, etc. Other than that, psychotherapy is one of the most popular and most recommended options by psychologists to help treat anxiety. Psychotherapy often involves cognitive behavior therapy, which is basically changing the way you think and perceive your problems. Cognitive processes are one of the most important factors in anxiety. How you perceive, pay attention, remember events often makes you worry about them differently. And changing the way you perceive an instant, an event, a person, or a concept is one of the easiest ways to change it. Once again, however, these solutions are not guaranteed, and often patients feel less anxious for 1 or 2 years before the root of the problem continues to attack them. This may sound like a cliche, but identifying you have a problem is the first step in solving it. And for many of these people, that's really difficult to do, because not only that they don't know that they have a problem, but at the same time, it's impossible for them to approach another person and tell them that they have severe anxiety. So as our jobs as their friends, their colleagues, or just a passerby that identifies that they have an issue, and they may not be outwardly crippled and they may not have physical damage done to them, but these are the kids and adults and adolescents that cry themselves to sleep every day because they can't make friends. They're the people that have seizures and panic attacks every night because they have too much work on their hands. And they're the ones that bleed their hands simply because they wash them every 5 minutes because they think that everyone thinks they're dirty. Anxiety may not be an outward issue, and a lot of people might find it hard to talk about, but these are some very serious problems that affect some very real people. So next time you think your friend or colleague is just worrying too much, take a moment.